Good morning, everyone. My name is Christine Levens. I'm the Vice President of the Minneapolis Regional Chamber. Welcome to this morning's Critical Issues Forum titled Housing Now, Affordability, COVID-19, Equity, Health, and Safety. Please note during the webinar today, your audio and video is muted. We are going to leave time for some Q&A today. So if you look at the function on the bottom of your toolbar, it's the double bubble. I'm sure most of you are familiar with that now. You're welcome to submit questions at any point in time today. If for some reason you're struggling with the audio, you can go ahead and click on the up arrow that's next to the mute button for audio help. If for some reason you are also having some other trouble, you can communicate with hosts in our chat feature. Please follow along today on your social media platforms and channels. Minneapolis Chamber is our handle. You can see at the bottom of the screen, and the hashtag we're using today is Critical Issues. You'll see shortly our speaker handles also, so we'll introduce you to that also. The Critical Issues Forum is brought to you by Thrivent, Comcast, and Xcel Energy. They're our presenting sponsors. Our premier sponsor is Wells Fargo, and our media partner is Finance and Commerce. We thank them for their support. They help us produce this series all year long in person. When we can do it, and now in this virtual format. So we thank them for their support. This morning's webinar will be recorded, so we'll share that with you post-event and a link that we'll invite you to share with others in your networks and within your own organizations. I'm really happy to have this panel today. We have some experts in the field talking about housing, talking about equity issues, and talking about how businesses and community can support home ownership and public health through housing. With that, I'm going to hand this off to Ellen, who's going to moderate this great conversation for us. She will join you in just a minute. I'm going to start everybody's video, and we will continue.
Are we all set, Christine?
Yes, apologies everyone. That was more than I could manage in the moment. Thank you all.
Thank you, everyone. Good morning. Thank you for joining us for this panel today. It's an important topic, and we really appreciate your interest in it. Last week, a study was released that showed 32% of households in the US did not make their full housing payment in July. This 32% includes 19% of the households that missed their entire payment and 13% that made only partial payment. And this includes both renters and homeowners. And this is steadily climbing since April, when the rate 1 month into the US pandemic was 24%. And additionally, households are increasingly concerned about foreclosure and eviction as moratoriums against these actions are expiring. The foundation for housing is shaky for millions of Americans. And in the midst of the pandemic, our region experienced the murder of George Floyd and the civil unrest that showed in stark terms the disparities that our region and our countries face. We see the disparate impact on lower homeownership rates for people of color and a disproportionate presence in homeless communities as two very specific examples relating to housing. We know that these crises have had profound and negative impact on the region, impacting businesses, communities, government, in addition to the families. And this is the reality of our region today. The hour that we spend together today is meant to provide some inspiration and commitment that we can change that reality. And so today you'll hear from 3 leaders in the region about the challenges to overcome and ideas and innovations in housing that can make a more equitable Twin Cities region. Each of the panelists will kick off the discussion with some framing comments, and I have some questions for the discussion. And as Christine said, we'll have time at the end for questions. So let's just jump in, and I'll start with DeAngelos, a principal and founder of NEO Partners. Tell us about the work of NEO and what you see as the immediate and near-term challenges and opportunities that we are facing as a result of COVID and racial disparities that our region is facing.
Wow, okay, diving right in.
That's right.
Good morning, everyone. DeAngelo Sunkeson. I founded NEO Partners really with the focus on how do we help the small business community through real estate services. Like we saw there was a real need in that market, but also when you look at where most of the diverse businesses are in the kind of funnel and spectrum of growth, a lot of them are concentrated in neighborhoods, a lot of them are concentrated in the small business cluster. And so, thinking about what has happened, COVID, there was a New York Times article that said roughly 41% of African-American small businesses are on the brink of failure due to the impacts of COVID. And then when you look at the aftermath of the civil unrest in the Twin Cities, peaceful protests that turned into rioting and looting, I mean, over 700 properties were damaged, over half of that on the Lake Street corridor. And so you talk about a diverse community that has lost a lot of its stability. It was already suffering prior to the civil unrest, but now we have places where people's housing and baseline incomes in the small business community have been fractured even further. And so when you talk about housing stability, we're talking about income inequality, we're talking about opportunities for advancement, we're talking about contracting opportunities. And so I think right now our region really needs to think really big about how we rebuild, and rebuild in a way that is reimaginative, and acknowledge that we cannot rebuild the status quo. Our status quo didn't work for people of color in this region, and this is an opportunity now to reimagine.
Good way to kick us off. Thanks, DeAngelos. Julie, let's go to you now. As the president of the Minnesota Homeownership Center, you've been engaged in the work in the community, specifically around homeownership, for 25 years. Tell us about what the center's work is and how you see the immediate and near-term challenges and opportunities that we face considering COVID and racial disparities.
Thanks, Ellen. Good morning, everybody. Julie Guggen, the Minnesota Homeownership Center. We are a nonprofit intermediary that is solely dedicated to addressing equitable access to homeownership. So we leverage our role as a funder, capacity builder, innovator, and advocate to uplift our community partners and amplify their clients' voices as we work towards this goal of creating equitable access to homeownership. We're grounded in the belief that sustainable homeownership is essential to fostering diverse and vibrant communities. We work primarily with lower income households and with a particular emphasis on communities of color. Last year, our client base was 65% households of color. 80% were first-time home buyers. We are committed to closing the homeownership gap that exists between white and Black families and ending the racist structural practices that have shut people of color out of homeownership for generations. Those racist and systemic issues were clearly amplified by the killing of Mr. Floyd, and are particularly amplified by what we're seeing in the COVID fallout. So we provide financial advice, homebuyer education and counseling, and foreclosure prevention counseling. Since 2008, more than 100,000 people have accessed services through our network of advisors, and close to 50,000 households have been able to maintain their housing despite the impacts of the Great Recession. Our network partners are trusted members of the communities that they serve. Our partners include organizations like Model Cities, PRG, Project for Pride and Living, Clues, Neighborhood Development Alliance, and a range of organizations that offer a variety of services to community. What we're concerned about in the wake of COVID is that if we do not act quickly to prevent foreclosures, the economic and social fallout of the looming mortgage crisis will erode our ability for economic recovery and set Minnesotans, particularly Black Minnesotans, back a generation as it relates to homeownership. Ellen shared some compelling statistics in her opening remarks. I would also add that the mortgage delinquency rate doubled in the Twin Cities in April, and an additional 20,000 mortgages in our region were delinquent in May. And we all know that many folks lack adequate savings to see them through a crisis. In May, roughly 7 in 10 households did not have enough savings to last 4 months, and 1 in 3 could last only 1 month without running out of cash. We've worked in this area for a long time. As Ellen said, we've been at this for about 25 years, but we fear that the crisis due to COVID may be worse than ever before. We are working quickly to deploy resources to ensure that we have the services in place that consumers will need as they face mortgage crisis due to COVID and the unemployment associated with COVID. In particular, we know that Black households are most vulnerable due to COVID. Black workers accounted for 8.5% of the Twin Cities workforce in the beginning of 2020, but account for 14% of all unemployment applications since March. So recently, one of the things that we're doing in response is recently we launched a campaign with our network partners and with our consulting group, Thunheim Associates. We launched a campaign to help get word out to homeowners facing economic uncertainty, that there are options available to keep them in their homes, that we have a network of free, non-biased, and trustworthy community-based advisors who can help them navigate their situation. The primary goal of the campaign is to connect every homeowner in need of assistance with an advisor, with the primary goal of stopping as many foreclosures, scams, and needless sales from happening as we can. We know that mortgage borrowers who receive foreclosure prevention counseling during the foreclosure crisis, were 67% more likely to be current on their home loan 9 months after receiving those services compared to those who did not get services. We recognize that only half of mortgage holders in the US currently know about relief programs that are now available through their mortgage companies that are backed by the federal government and Fannie Mae. We need to get the word out that there are options available to consumers. It's a primary goal of ours. We're very concerned about the additional unemployment insurance that's ending at the end of this month. We're concerned about forbearance options that are soon to expire. We're concerned that consumers don't fully understand what their options are post-forbearance. So we're working hard with our network partners to get the word out and really assist consumers who are impacted by this unprecedented pandemic. Thank you.
Thanks, Julie. Next, I'd like to hear from Dr. Mai-Khao Hong, who is the Vice President and Founding Dean of the Morrison Family College of Health at the University of St. Thomas. Mai-Khao has a long-standing connection to housing in her recent work as CEO at the Wilder Foundation and previously as the Director of Resident Services at the St. Paul Housing Authority. Mai-Khao, tell us a little bit more about the Morrison College and its vision for integrating health and housing, and then speak specifically, if you could, about the challenges and opportunities that are present today, relevant because of the intersection between housing and health.
Yeah, thank you. So I'm leading the college, the formation of a brand new college at the University of St. Thomas that's bringing disciplines in community work, in public health and health promotion, and in psychology together. So the vision for the Morrison College is that we will be educating the next generation of health and community leaders who are really working in service to the whole person in the context of family and community. In other words, within the bonds of humanity and within a place-based setting, which is where usually everything happens in neighborhoods and in community, regardless of what policy structures we're talking about. We saw this during the murder of George Floyd. Those of us who've been working on racial equity for a very long time in our entire careers know that George Floyd and what he represented was not a solo incident, that these neighborhoods and the communities that are really needing investment have been disinvested in for many, many years, stacked over generations, actually, and that there are barriers racially, economically, politically, and socially to how we can move forward. So the hope of the college, which is actually really elevating social work, psychology, public health, and actually health promotion and well-being, is connected to housing, because we know that when families are safe and healthy, they are productive, and that the unit of operation for most of society is the household. It's not individuals. And though individuals are very important, the informal networks and systems of help that can help retain housing, whether it be owned or rented, is really important. So I think we're in the middle of two pandemics right now. The first is called COVID, and the second is called racism. And racism and health and housing are infinitely, inextricably linked to intergenerational policies that have created advantages for some and disadvantages for others. So we know that when people are in stable housing, whether it be owned by them or decent and affordable in terms of rental assistance, that they're just healthier. They do better, their kids learn better, they live longer. So on the place-based pieces related to affordability for the Morrison College, there are three factors that really impact health in terms of social determinants, and that would be poverty, which is really income, and it's related to employment. Housing is a huge piece of that, because the house that you own, as it relates to the discussion today, is often your biggest asset, your most important asset. It's where you spend your most money. It's race in terms of how you get treated, not because of what you think of yourself, but what society how society treats you. So you know, that's a huge piece of this as well, and place, and that's location geographically. So though we often talk about the disparities related to really, you know, because we're in the metropolitan area, some of the worst housing and some of the most help is needed actually in rural areas as well. And the trifecta of these factors influencing and impacting health and well-being, which is about, you know, if you count this related to our GDP, healthcare, just the delivery aspect, is about 18 to 19% of our GDP. If you look at health and well-being more generally, there's almost no way that you can get to work, you can get to childcare, you can get to gainful employment if you don't feel healthy. So many of the people who are on the streets are people who are struggling with poverty, instability, mental health concerns, just aging and disability. So the Morrison College, unlike some colleges of health, is really not leading with the intervention side. It's really with prevention, early intervention, and these community disciplines of ensuring that we're looking at the entire system. And I'm excited to actually be here in this conversation because a number of years ago, there was a policy report that really impacted me, and it was the current commissioner of health at the time, really looking at health and all policies. Until we actually get to health and all policies and we look at housing as essential to employment and good health, and also just well-being generally with learning, we're not going to overcome some of the racial disparities that we see in society today.
Thank you. Really strong points to add to the discussion. DeAngelos, I want to come back to you and ask a specific question related to kind of the sense of community. Over the last few months, we have seen the role of community in anchoring and helping its members really be spotlighted. We saw that around neighbors coming together to help each other buy groceries. And we certainly saw it in the wake of the unrest, or in the middle of it, where communities came together to look out for one another, kind of respond to crises in real time. And it really highlighted for me the importance of community and that sense of place that really highlights and builds on what Mike Howe was talking about. So financial distress or the rebuilding really potentially could threaten that sense of community. I wonder if you could talk about what you're doing to protect local real estate ownership, or the sense of community ownership of real estate, particularly focused on communities of color.
Sure. I think so. For one, I was a part of that same kind of group, immediately after, I would say that week of between June 2nd and June 11th, myself and 4 other families in our neighborhood formed community around kind of protection and safety. I mean, we're a few blocks off of University Avenue, on the way to the governor's mansion, on the way to the Capitol, on the way to Midway. So we saw in 3 directions a lot going on during that time. And, we already knew each other, we were friends, but I think the bond that was formed in looking out for each other through 5 a.m. for almost a week and a half straight really forged a relationship that we're leveraging now to do other things. And I think that's probably the nugget that we really need to hone in on, is that community was formed in neighborhoods in ways that it probably hasn't been in many, many decades. I mean, so I use a real stark definition that neighborhoods are the physical place-based assets and physical geographies, where communities are the connections and the networks between the people who either reside in that neighborhood or who reside across the metro area. And I think our region at one point got away from neighborhood relationships and neighborhood-based community. I think we see in a lot of places that a lot of people really don't know who their neighbors are. And so this event hyper-localized our community networks, in which your neighbor was really important in the neighborhood security. Your neighbor was important in the grocery or food distribution networks. And so I think there's going to be a lot of outgrowth from that work, that neighbors are now forming and reforming those strong community ties. And those community ties, in my opinion, are the capital in which the private sector, as well as the nonprofit and philanthropic sector, need to come alongside them and empower them to recreate and reimagine the things in their communities and in their neighborhoods. And I think that's where I am raising kind of my awareness, but also my leadership in this space, is that, as a service provider, you can only do so much in the space and helping. And sometimes you need someone to be alongside you with the capital. And so we're looking at innovative ways to bring capital alongside community members that empower them to actually, when they come up with the vision, they can deploy capital to actually execute the vision that the neighborhood and the residents have come up with. And that can be through a number of mediums, whether that's a community cooperative, community land trust, commercial land trust, community investment cooperative, a number of different ways in which the people on the ground are already doing the work. They simply need someone to come alongside them in many respects and kind of champion their existing causes.
Thank you. Julie, I wanted to think back for a moment about the foreclosure crisis. Some of our communities are just recovering from the mortgage crisis of a number of years ago and have just gotten the value back that they lost in the middle of that crisis. I wonder if you could talk a little bit about what is different this time, if there's anything different that we could learn as a community to help support community members earlier. And you spoke in your opening remarks about the need to act quickly and how to get people's attention to get into any of these options. But how can we, are there more options for homeowners now? And talk a little bit more about building on that from the last crisis.
Yeah, I think one of the stark differences between our current environment and the Great Recession is that the federal government reacted quickly. And for those mortgages that are federally backed or backed by Fannie Mae and Freddie Mac, there are now forbearance options in place, mandatory forbearance options if consumers ask for them. So that means that if a consumer demonstrates that they've been impacted, their ability to pay their mortgage has been impacted by COVID, the payments can be deferred, not forgiven, but deferred for a period of 6 months and perhaps a renewal period of an additional 6 months, depending on your loan. So that very coordinated federal response has been extremely helpful. In addition, I think mortgage companies were far more responsive this time around early on than they were during the Great Recession. They now take their role as a contributor to stable communities and stable households very seriously. And many of them, even if they're not required to, are offering forbearance to their consumers. So this idea of deferring payments fairly readily is great. So consumers should be asking whether they are eligible for those forbearance plans. And my industry, the homeownership advisors, are better educated and are better equipped to negotiate with lenders when consumers are facing crisis than we were at the start of the Great Recession. I think what's also interesting to note is during the Great Recession, we had the real estate industry was reeling and property values were in decline. Many homeowners could not sell their properties because they were underwater. They owed more than their properties were worth. We're not seeing that decline in value now. So one of the options consumers may have if they can't pay their mortgage or find themselves otherwise in financial straits is that they can sell their property, which is a good thing if that's what they want. But what we want consumers to understand is you don't have to sell your property, that there might be other options for you. We're concerned, quite frankly, about scams, cash deals, people knocking on your door saying, you know what, we can give you cash for your property now and you can get out from under your COVID financial crisis. And if consumers really want to stay in their house, they need to know that there are options that can help them that doesn't involve these sort of needless sales. So I think those are some key factors that are different this time around.
Thank you.
Thank you.
Michael, you mentioned something in your opening remarks, and I want to loop back to that. And I think one of the impacts of COVID and the civil unrest has been the increase in the number of people who are living in public spaces or encampments. So we're seeing, and certainly has got media attention. I wonder, from your perspective, again, based on this intersection of health and housing, but also in your experience, drawing on your experience from Wilder, what we should be doing to better address people who are living in public spaces and how to better support them in their search for more stability.
Yeah, I think people often think about encampments or individuals who are, or families that have fallen into homelessness as one big group, and that's in fact not true. So if you think about how unemployment rates have really skyrocketed, and how the jobs and positions that are actually available for people who perhaps don't have a college degree, and keep in mind, a lot of people with college degrees can also end up on the street. And so that happens. But the longer we go with unemployment rates being as high as they are, and I would also say the other thing that we know is that health and well-being is seriously compromised, and taking a psychological and social and emotional toll on many families as in your networks, because we're very economically and socially segregated as a society, particularly here in the metro area. If you've been reading up and paying attention to how we don't have equitable development. We tend to invest in somewhat similar neighborhoods, and we have patterns where in some neighborhoods, despite the good intentions of many philanthropic entities, not sustained investment from the corporate and private sector with jobs and availability, that the rates of homelessness, particularly those who, what I would say were near homeless anyway, with potentially losing housing, now losing housing. So prior to the COVID crisis, the Minneapolis-St. Paul region was already growing faster economically than the national average. We were already in a really tight rental market, and now that has been seriously compromised and exacerbated by people who are perhaps going to lose their housing, people who are have lost employment during this time, because many organizations, and we're all in the same place, regardless of what type of organization that you're in, the lack of economic activity, and therefore the lack of jobs, on top of the really stresses of COVID and social isolation. You can see it in the panics with people buying toilet paper, wondering if there's going to be enough food. On top of what I would see as the second coming of a civil rights movement, with Minneapolis and St. Paul here as part of the epicenter, where we're coming into racial consciousness. This is all really taking a toll on people. I'm not suggesting that alone is creating some issues. I think there were structural problems here before COVID, and those have just been exacerbated because of some of these other issues. The other thing is, as people lose healthcare, because we have an employer-based health insurance system, as people become uninsured and they also get sick, or they take in, this has happened to many families, frail elderly who are you're caregiving for into your homes. You're trying to work, you've become a multi-generational household, and you are stressed. At some point, there's a break point with the ability to do that, especially if you have lost your job. So I think that there are many, many factors. There are many solutions to encampments. I mean, if you could segment those populations and say, is it someone who has fallen into this situation temporarily? Is it someone who has mental health and chronic disability issues where they've just been squeezed out of the market? So I think those situations are very complex. And the reality is we are in a low interest rate environment where construction is very expensive. Not many people are building. And also nonprofits that typically have been able to serve families and individuals who are on the street are also seriously compromised in terms of the delivery system. I think a cash infusion that's flexible, that can be delivered through grassroots organizations that are working with these populations would be extremely helpful. Organizations like Wilder, Catholic Charities, Common Bond Communities. I mean, I think that would help, but I don't see any relief on long-term issues unless we actually build more affordable and quality housing in Minnesota.
Thank you. There are a number of points, and I want to tie it into a question for DeAngelos. That I think your point around the complexity of the issue of encampments and homelessness is really important to think about different things that people need. And I'm sure that many folks who are listening saw the governor's announcement yesterday that is working to RFP through Minnesota Housing to find partners who can deliver some financial assistance to help people pay back rent and get stable. So I think that really builds on, Mike, how one of your points that you made around those community-based organizations that can really help people move into that next step. But I wanted to tie that into your comment around, I think, awakening a civil rights movement here in Minnesota and anchoring racial equity in this work moving forward. And turn it to DeAngelos and talk, you said really compelling things about, the role of community and giving community voice. How can we in government or civic leaders or all of us listening support the kind of work that really does center equity as a key value that we want to do more than the status. We want to propel our communities forward again and not just have the status quo. What is the key thing that we can do and take away as a starting point in that conversation? What can we do to support your work?
Well, I think I'm glad we all saw the governor's bill, and I think there's another one that they're working through the different committees, the Promise Act, which will be very specific towards the redevelopment and compensating businesses and individuals who were devastated as part of the unrest. And so, I think to Mike Howe's point, there needs to be a capital infusion. And I think that, we have the capital in the region and from our corporate community and our philanthropic community. But I think how we have given capital in the past may not be the best method. And I think there needs to be capital given in a partnership mindset. And not a typical grant making mindset where I give you the money and you kind of just run off and you send the report, sometime next year. I think we need to leverage and cause our institutions to lean into the problem solving, because the affordable housing conversation, and I mentioned this a little bit before, but we have just systemic challenges in our mortgage approval rates for people who are qualified. And if you see people of color denied at almost twice the rate or 1.5, depending on which study you look at. These are people who are qualified for homes that are in the affordable range that are just being denied access to purchase homes across the country. When you look at studies recently out of Boston, when it talks about housing discrimination in the rental market, where people of color and African Americans in particular were discriminated against at 80% rates in the marketplace. We're talking about things that don't require so much brain power. Like these are not big red tape issues. These are just everyday functions within our system that we have to recognize need to be adjusted. They're operating and they need to be adjusted in partnership. That means when you provide capital into your neighborhood partners, into program related investments, into other avenues, you need to also lean in with your staff, lean in with your senior management, and adjust things within your organization that are also hindrances. Everyone and even every organization has something that they can be getting better at in the region, and not just provide capital and say that's someone else's problem. I think each of us have a part. Your capital is an important part, however, but your organizational system also needs those adjustments as well.
That's a great segue, DeAngelos, to give an opportunity for both Julie and Mike Howe to answer, and specifically, what besides money? Money obviously is really important, but what are some of the other things that fundamentally need to shift, create greater opportunity? So I'd love to hear Julie and Mike Howe respond to that as well.
Yeah, I think just picking up on what DeAngelos pointed out, there are still pervasive and deep-seated systemic and racist practices that are influencing individuals' ability to purchase homes. We've heard a lot lately about redlining, racial covenants, predatory lending practices, particularly targeted at the Black community. Those still exist. to a degree, and we need to work together to figure out how to dismantle that. But perhaps less well known are issues around whether there's adequate supply and equitable access to down payment programs. Our state housing finance agency has one of the best down payment and mortgage products around, and they're doing a great job in reaching communities of color. But there are other ways too that I think down payment is not serving the consumer base, particularly in communities of color, that we need to address. The dollar amounts aren't enough to cover the cost of down payments. The sheer lack of affordable supply, particularly in communities where in the metro area where people want to stay and raise their children. The lack of affordable supply, to me, is really a fair housing issue, and that will take different models of construction, different models of ownership, and an infusion of capital to address supply issues. And then another fallout from COVID is that it's getting harder to get credit. D'Angelo's pointed out the denial rate for households of color, but credit scores are now, minimum credit scores are elevated now more than they have been in the last several years. And that's going to leave a lot of people out. And communities of color still are charged more for mortgages. The cost of getting a mortgage in terms of your interest rate and what you need for a down payment is more for communities of color. And that we just can't sustain that. We've got to work together to address a lot of these things.
Mm-hmm. Yeah, I think as it relates to racial differences and what else can actually be done, I agree with D'Angelo's and with Julie that there is a fair amount of discrimination that can actually be traced. You can see the differential treatment in terms of the consistency of standards that are applied to an individual who is Black or family that's Black or Asian or Latino, quite honestly. And what homeownership rates look like, the real value of neighborhoods that become more diverse, what happens there in terms of the value of the house, what happens. So we know that these dynamics were propagated and promoted actually openly in the 60s, and that they kind of have continued to live today. But it's not just history, it's actually also current practices with many local, a lot of local opposition to building affordable housing. It's always coded, the actions are always coded, and they're coded because they're not really called, they're not really, the not in my backyard activities are not necessarily so much sometimes related to poverty. They're related to race, because people don't want individuals who look different that they see as deviant actually moving into their middle class or suburban neighborhoods. So what's resulted is a pattern of really a lot of spatial, social, and racial segregation in Minnesota. And I think that that's bad for us as a society, because it makes us less economically productive. It also, there's also a body of evidence now, research-wise, that shows that when you have investments in place, which a lot of that investment is housing, that actually the quality of life will improve, and employers may perhaps want to move in and all these other things. I guess the different angle I would take is also that there are policy decisions, and actually the consistency of those policy decisions stacked up over time, that is very individualistic and what I would say insidious in Minnesota, which is, we tend to look at an individual with health and human services as, and we've captured this in our policies as deviant somehow, or not deserving, or punishing if you're poor, instead of systems of helping, really helping to build on resilience and assets. So there's been a fight over time in health and human services to really think more generational, to think multi-generational, and to think beyond one cycle of relief. But our relief programs aren't structured as family-centered, and so that becomes a problem, because you have many factors that are influencing whether or not people can live in decent and safe affordable housing. So another way to go about this would be to actually reimagine what we can do with childcare services and assistance to help people stay in employment. What we could reimagine with Health and Human Services and Medicaid, which is the federal program, but medical assistance in the state of Minnesota, to think creatively about health and housing together. So there are some really innovative things that are happening in Minnesota related to it, but it just always stops short of having a huge transformation occur. There are also other solutions like pouring more money into rehabilitation, renovation, changing homes that currently exist to accommodate someone with a health or disability in a different way. And the reality is, homeowners have a big fight if they want to do this, to actually come up with the dollars necessary to actually improve their homes in order to meet the needs of the elderly, parents that want to come to live with them, or a kid with a disability. So those dollars are in pockets, lots of different pockets, but actually having a consolidated and more integrated strategy across landlords and what I would say homeowners would be really, really helpful.
Good points. I heard in this discussion and all of your responses, a combination of what I might describe as private sector policy changes, how they do their business and how that could support changes could support greater a more inclusive and equitable recovery or framework for us. And then I also heard some elements around government. And I wonder if you, all of you could just say a few words to kind of end this part of the conversation. We can open it up for questions from the audience if there are any. But really, what is the role of private sector and government as two separate kinds of policy making entities that can really change and create the momentum that moves us in the direction that blows up the status quo that D'Angelo's talked about it in his opening remarks? How can we get some real traction engaging private sector in addition to government? What are the most important things that both sides could do? Let's start with you, D'Angelo. Do you have thoughts about that?
Yeah, I think, it goes back to Julie's point about some of the supply side issues that we have in our community, and just how do we make it easier to get through the funnel of actually doing the work. To my college point, like, why are we don't have a collective impact mindset where we're all working towards a collective goal. And so we have these bureaucratic boundaries and parameters that cause undue stress and undue kind of financial strain on the people who are actually trying to practice and produce the outcomes that we're all working towards. That's one, is to wrap our minds around collective impact of the work from the government and private sector, and how can we eliminate the kind of double redundancies of costs. The second is we cannot supply side our way out of affordable housing issues. And we have to deal with the demand side of it, which is very much an employer-driven outcome, is that we aren't seeing the same amount of wages in proportion to revenue, in proportion to leadership salaries, in proportion to profits that we've seen in prior decades. And we're seeing basically the base of our Twin Cities salaries continue to decline, as well as renter salaries continue to decline year over year, our wages, if you will, year over year. And we're not addressing that as part of the holistic solution towards affordable housing and creating affordable ecosystems and removing the demand for more and more affordable housing by how do we have an economic development policy that also supports our affordable housing policy and not in opposition of it.
That's a good point on wages, and we didn't speak very much about it. I think one of the other questions that we'll have as a community is how jobs and change as we come out of this pandemic, and what that shift in what might exist in terms of the labor market. So thank you for bringing that to the conversation. Julie, what about you? What are your thoughts about this?
Yeah, it's hard to follow D'Angelo's. I agree with what he said. I think at the very local government level, we need to see real change in terms of communities, to my cow's point, communities willing to accept affordable homeownership. You know, the idea that developments can be discriminated against because of the income of the people who might be able to afford to live in those developments just needs to be a thing of the past. So we need local governments to invite in affordable homeownership and embrace it and make it a pervasive part of their community fabric. And that's just, we haven't gotten there yet. For all the years that I've been doing this work, we're just still not there. I do think in terms of the private sector, especially when I think about the lending community, we need to establish some real patterns of accountability that get at this subject of denial rates and cost of mortgages to buyers of color. And we need that. We need the private sector to step up and say we're going to create our own levels of accountability, because certainly during this current administration we're not going to see that from federal regulators. In fact, there were cases this week that were announced that the government is not, the regulators at the federal level are not going after these unscrupulous practices right now. And then I also think we need to dig deep and look at look at the whole credit score and credit reporting and that whole industry in terms of how lower income households who are right now paying their exorbitant amounts of rent that they can't afford, but somehow manage to do that. That needs to count. And we just need to look at that whole, how we think about credit and affordability differently if we're going to make an impact.
Mm-hmm. Yeah, I agree with Julie. Just really quick, because I know we're running out of time, is I think the lack of access to capital for low-income families, and to actually most people confuse affordable housing with actual development. Most of the affordable housing in Minnesota is actually developed by private developers. That's 99%. Houses become affordable over time, and you might actually be in affordable housing and you're a homeowner. So I think there's some misunderstanding about that, just generally with the private sector and actually also the public sector, that affordability is not only a government issue, it's a workforce issue. It's an attraction to stay really an economically vibrant community. And so I think what the private sector could do is generate an understanding about this. And I know that the Itasca project, which I'm a part of, has been trying to do so, that housing issues are about economic vitality. And that message is not getting it out. And also that affordability and affordable housing development does not only belong in the purview of nonprofit developers. In fact, a lot of developers are actually private developers. And so one of the things the government could do to actually generate on the supply side and to also help meet more of these demands for workforce housing and affordability is actually to support local community development organizations and to have a better cash infusion into these organizations that know how to do it in their local communities. I would also say that the safety net keeps getting redrawn with public services, and it's been drawn very small around families and affordability for families. It's been drawn larger for the elderly and those with disabilities, and it's not been drawn at all for families that are living on the fringe, probably the families that Julie is seeing. They're really at the 50 to 70% of average median income. They're really stuck in a hard place. And for homeowners who are not necessarily on the rental market and not having fallen deep into housing issues with homelessness, there's a huge gap. And so that's to be solved probably by really smart nonprofit leaders in a cross-sector collaborative. And that is the innovation space that we haven't really talked very much about, because when you can't house a 10-year-old for 2 to 5 years, that becomes an intergenerational poverty problem. with lack of education and learning, and not having a place to lay your head down. So that's where I would say income inequality has become a problem. And we can't look at poverty and only see people that we think are deviant. We need to actually think about how it doesn't build a strong society when we don't have strong housing as an anchor for development and for work and for actually living in a vibrant society.
Thank you all. A special thank you to the three panelists. I appreciate your comments. And since you did such a great job of highlighting really key points, no wrap up is required because you hit great summaries and great takeaways. So with that, I'm going to turn it back over to Christine.
I absolutely concur. And thank you so much, Ellen, for moderating this conversation. DeAngelis, Julie, and Mike, thank you so much. Apologies for the rocky start. There's only so many things a girl's eyes can manage at one point in time, and today that was absolutely proven. I want to, in wrap up, thank our sponsors who you see here on our screen. We thank them for their support. Again, we've recorded this webinar and we will share it post-event. And lastly on the slide here that is coming up, you will see upcoming events. You can see there's a great variety here, from the Vikings to a Meet the Chamber networking event to a business program talking about pivots and partnerships during the pandemic. So with that, again, I want to thank all of our participants. You were wonderful. Thank you for sharing your depth of knowledge. And with that, I'll wish you all a good day. Thank you so much, everyone.